Hey everyone, my name is Kaylee and I want to go into dental hygiene, so I will be discussing reducing gum disease by increasing scope of dental service in Pueblo schools. There are many people who suffer from gum diseases such as gingivitis and periodontitis. According to a report done in 2005, approximately 35% of surveyed Coloradoan adults reported that they had lost a tooth from gum disease. We see cases more locally as well. Brooke Watts, a dental assistant in the Pueblo area, states that she typically sees 2 to 3 cases a week, and Watts only works part-time, so if she worked every day, there would be at least 1 case a day. And that's in one office in all of Pueblo alone. While many factors likely contribute to these results, the most prevalent factor is the fact that a majority of people don't realize the link between their oral health as a youth and their oral health later in adulthood. While cases of gum disease continue to increase, a solution to minimize this problem is becoming imperative. I will provide an analysis of the issue that covers causes, effects, and insufficient solutions, and I will also outline a tentative solution that may be offered up, aiming to aid local dental professionals in reducing the number of patients suffering from gum disease by offering dental care in Pueblo District 60 and 70 schools. The true root of the problem is poor oral hygiene. Oftentimes, the development of gum disease commonly begins in childhood. Kids who don't possess good oral hygiene skills carry their bad habits into adulthood. But let's talk about gum disease in particular. Gum disease all starts with plaque. Our mouths are constantly filled with bacteria, mucus, and other particles that all mix together to create a clear, colorless film that settles on the teeth. Taking the time and care to brush teeth daily removes plaque, but if it is left on the teeth for too long, it hardens into tartar and starts to irritate the gums. This condition is referred to as gingivitis. If the condition is allowed to worsen, the disease is then called periodontitis, which is much more harmful. In this case, the tartar advances past the gum line, causing the gums to become detached from the tooth. Pockets are created around the teeth where bacteria grows, causing infections. At this point, the body attempts to fight off the infection, but the process often results in the breakdown of the tissue and bone that keep our teeth attached. The effects of periodontitis are usually detrimental. A dentist may try multiple surgical operations to shrink the pockets, and occasionally loose teeth can be stabilized. However, if the condition is caught and diagnosed too late, teeth are very susceptible to either fall out or needing pulled. For most, this is the case. With periodontitis being the leading cause of tooth loss, a solution to the problem is needed. When it comes to insufficient solutions, the most common method of preventing various gum diseases typically consists of merely educating a patient on good hygiene. Hygienists are responsible for demonstrating the appropriate use of toothbrushes and floss to patients upon every visit. Most people take the time and care to heed this advice. However, many adults and children don't even see a dentist regularly. According to a 2005 study, about 1/3 of adults over the age of 18 hadn't seen a dentist in over a year. People who don't regularly see a dentist are at a much higher risk for gum disease. With gum disease being one of the leading causes of tooth loss, something must be done. To truly stop the problem in its tracks, we must go back to the very beginning of it: poor childhood dental hygiene. It's very common for children who lacked regular dental hygiene practices to suffer from ailments later in life because they haven't developed good oral hygiene habits, and it continues. This phenomenon is usually expressed in children who belong to families that fall into the lower income category, where parents can't afford to send their children to a dentist. With this in mind, the proposed solution will have to do with better inculcating daily dental hygiene into young children's minds by allowing lower income kids to have access to clinical dental services within their schools. These children will be able to have regular and typical dental appointments. With a program like this in place, the importance of good oral health will be more present in a child's mind, causing the child to be more likely to carry that ideology with them throughout life thus reducing the number of adults that will be diagnosed with gum disease in the future. Such a proposal isn't something that can be put into place overnight, so there are factors that must be considered when implementing the plan. You may think about the setup a typical dental office has, including the computers and x-ray machines, and wonder, how will all this equipment make it into a school? Fortunately, technology has come extremely far since most dental offices were established, meaning that smaller, more compact, and portable equipment can be used in these temporary school clinics. Mobile setups such as these would allow for a clinic in a designated part of the school that wouldn't need any special infrastructure put in place to operate, such as in a gym. As far as which children will be given a screening at school depends on the socioeconomic status of the child's family. Children who come from families that can afford to go to the dentist regularly will not be given screenings, as there wouldn't be enough manpower. Therefore, lower-income children will be made the priority of these visits. As a result, some schools in Pueblo may require more attention based on how many low-income students in the school. Most dental hygienists work for a private practice, so it makes the most sense to occasionally pull hygienists from their regular practice to work in schools and take special care of the low-income children. Just in the Pueblo area alone, there's over 40 private practice dental offices that all support a large team of hygienists. With plenty of hygienists to go around, the temporary clinics could be fully staffed. With any proposed solution to such a major problem in our local area, there is going to be objections. While there are plenty of hygienists in Pueblo, there is simply not enough dentists. Because of this, some may ask how the hygienist will be able to function if a dentist can't be present at all times. Luckily, in Colorado, this isn't an issue. Many states across the country require a dentist to be present for a hygienist to perform basic functions, but Colorado is not one of them. Registered hygienists in Colorado are allowed to perform all the basic functions as they deem necessary. This style of licensure means that dentists won't need to be present in school settings. Additionally, money is required to make changes, and it would most likely be the district paying for this program, but money can also be saved. A 2017 socioeconomic study based around the very idea of creating a school dentistry program suggested that about 2/3 of the cost would be from labor, which is why hygienists would be the ones doing this type of work, as it is more cost-effective for the schools. The study also addressed the cost-effectiveness of this strategy, determining that a school-based dentistry program would be financially viable. This is because it would cost more to treat children who don't see a dentist regularly than it would to treat children who have healthy teeth because their school provides routine access to a dentist. Overall, the program would pay for itself in less than 2 years. Finally, to determine the effectiveness of this solution, there must be a plan set in place to analyze the program. One simple way to track the progress of this program is to simply re-screen students. Schools could collaborate with visiting hygienists to record the oral health of each screened student. After several years of being examined and treated as part of this program, a student's record will reflect 1 screening per semester, so any sort of changes in the student's oral health could be observed. This rescreening process would need to follow students into middle school at the very least, because lots of low-income students begin to show signs of gingivitis as early as 6th grade. In time, the number of children that are developing gum disease this young will actively decrease, leading to a healthier generation. In conclusion, this is an issue that affects adults everywhere, but we can minimize the problem here in Pueblo by providing dental services to lower-income students who are more likely to develop gum diseases in the future. By doing this, our school districts will be able to have an active role in creating a healthier population in Pueblo. Thank you.